Welcome back to the Ologies. Today is SurgeryOLOgy.
SurgeryOLOgy.
Thank you, Clint. And as always, I'm here with Clint Bruce and a very special guest, Terry Gemas.
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 We've already talked about this.
Jeez, the G's and J's.
Hey, you know who's not here right now? Lil Sweet.
Yeah, he's still looking for
Yeah,
the
no, I
other-
told him we changed. I gave him a different address now.
Yeah.
I keep telling Lil Sweet that we've changed our offices.
Okay, who's Lil Sweet?
Bill.
Oh,
Bill.
Bill.
Yeah. So he never comes here. He goes to where he thinks the office is that day. So I've sent him like the Comanche Peak nuclear. So that went great. That was really fun for us. Sorry,
Terry. No problem. We're all used to it by now.
Oh,
So Terry Gemas started off playing football at Clemson.
Small school.
Went back, finished his undergrad at the University of Nevada in Las Vegas. From there, he went to medical school at the University of South Carolina, residence training in Cleveland, Ohio, and then sports medicine fellowship at the U in Miami.
U.
Did I get that right?
During the
Yeah,
national championship runs in
Yeah,
the early 2000s,
that's right, yeah.
right?
That must have been a fun time. A lot of injuries, I'm sure.
No notable players on that team at all.
Yeah.
No, just across the board.
Across
Fantastic.
the board.
Yeah. No, it was fun. It was fun working.
And Frank
with those
Gore's
guys.
still playing.
Frank Gore's still playing. It's hard to believe.
You're currently running your own private practice, right? Past 20 years?
Yeah, I've been here in Dallas for 20 years, and I've been private practice. Yeah.
What brought you to Dallas?
Yeah, actually, when I was at University of Miami, it's kind of like medical training is kind of like military training.
Mm-hmm.
You're in there and you put a lot of hours in for no pay.
Yeah.
So you guys can relate to that.
We got paid like 46 cents per hour. Or something like
I get paid less here.
Well, that's kind of what it is for us too, if you do the numbers. But it's kind of similar in that sense, and also it's a hierarchy. So every year you kind of move up the hierarchy. So you do all the scut work when you're an intern, and then you move up, and then everything rolls downhill, just like anything else. So
Sure.
as you move from whatever lieutenant, captain to major, everything rolls downhill.
I tell you what, my wife was a medical recruiter, and she recruited doctors. And orthopedic surgeons were at the top of the list for people, A, pay-wise, and B, hard to get, especially when we're talking about taking them out to, let's say, Montana or Alaska, somewhere.
When you say hard to get, you mean like
they're tough to.
They're in demand. They are in demand.
These aren't GPs. These aren't the pediatric, the children's docs. These are people that are highly specialized.
Yeah.
Is that correct?
No, I'll give you some numbers. When you go out of medical school, when you're in medical school, you have to decide what specialty you're going to go into.
Right.
And so, to give you some numbers, for family practice residency across the nation, roughly there were, at least when I was going through med school, there were about 3,000 slots. Okay. For residency.
Sure.
Per year.
That's nationally?
Nationally.
Really?
And only about 2,500 to maybe 3,000 apply for those slots. Okay, so you're going to probably get a spot because it's somewhere. In orthopedic surgery, there's 500 spots a year, and there's about 2,000 folks applying for those 5,000.
So of those three, well, how many people are applying in general for residency?
Oh boy. Well, you do the numbers, I guess. Like my class had 82 people.
So what I'm getting at, that's a very sought after.
Yeah. So what I'm trying to say in a different way to kind of piggyback off of what you were saying is that orthopedics, relatively speaking, there's smaller numbers,
right?
But there's a high demand for trying to get into that residency program, which means they can pick the cream of the crop from the medical class, which
it should be like that in a sense, right?
Well, yeah, but here's the thing: orthopedic surgeons are. There's a joke about orthopedic surgeons.
I've met a few, and I think I might know where you're going with this.
Yeah, orthopedic surgeons. There's a joke about orthopedic surgeons. It goes something like this. It's orthopedic surgeon is twice as strong as an ox and half as smart. But that's not the way it is nowadays because it's such a sought after craft. Right. Let me step back for a second. So back in the 60s, 70s when orthopedics was just kind of getting really popular.
Yeah, it's like you're an auto mechanic.
Yeah, it was like the bottom of the medical school class went into orthopedics.
Really?
Yeah. And then when it started,
People didn't break bones, or you just couldn't do the surgeries then.
But it's like now they got all this great technology, so it's fun. You're like playing with all these like arthroscopic surgery that's minimally invasive and using these computers and all that. So then it became kind of geeky a little bit.
Yeah.
And so then what they found was in the 80s it started to shift where the best students wanted to go into orthopedic surgery. That is the best ones who wanted to do a surgical type of specialty. And if you had that mentality, I want to do surgery, like I'm going to go into ortho because it's cool. It's cool. You're doing stuff like that.
The mentality. Let me ask you about that.
Yeah.
People oftentimes, especially in the military, we get in over our heads. Like when I joined, I was in a special forces contract, and I realized, oh wow, this is a different playing field. Mm-hmm. Is that something that you experience?
Personality is a big part. You go through in medical school, you go through every specialty.
Sure.
So you go through OBGYN, you go through general surgery, you go through internal medicine, pediatrics, psychiatry. You go through them all. You hit them all. And there's a reason for that, and the main reason is in every part of medicine, even orthopedics, I will apply some basic concepts, say, of psychiatry in that. In my daily practice.
Yeah, you did that when you Jedi mind tricked me into reattaching my bicep.
Right.
Because I was wearing a Brett Favre Copperfit sleeve, which it was going to fix itself eventually.
Yeah.
And then he did this little.
That product's tried tested.
These are not the droids you're looking for. And then the next thing I know, I'm on a surgery table get my bicep reattached.
Well, I think that's another show, non-complianceology, and Clint's the poster child of non-compliance.
Most certainly. He's built his reputation on it.
It's a misunderstanding most of the time.
What's the washout rate with surgeons? Okay, my grandfather was operated at a triple bypass surgery in Houston by one of the most famous cardiologists in Houston. You'll probably know his name.
Probably DeBakey, I bet.
Yeah. He was one of the first.
That's impressive.
Yeah. That is, I can only imagine the stress. And not to mention, like my dad's has gone through and had some minimally invasive stuff going on with his heart. Mm-hmm. It's scary for the patient. It's scary for the family. What kind of stress are y'all under?
Yeah, I find it very interesting. I'm getting these questions from, retired military guys.
Sure.
Because I sit here and I look at you guys and say, you talk about stress. I mean, I didn't have like bullets flying by me. You know? I mean, it's a little different now. Having said that, I've always said this for so many years that going through medical school is probably, from a mental standpoint, the mental part is very similar to somebody who goes through special force training or SEAL training or what have you. Yeah. But the little difference, yes, it's definitely mental for you guys, but obviously it's more physical than anything.
Sure. And we get to take our shirts off.
You get to take your shirts off. We got to keep ours on. But here's how I used to describe medical school, and at least in the beginnings of medical school, because there's talking about your washout, that you washed out the most in the first semester. And the reason was you had all these people who were really smart in college, so they breezed through college at maybe going through second or third gear. And I'm not joking when I say this. If you don't start on day one of medical school, not day 2, not day 7,
right?
If you're not in 5th gear, you're gonna get behind.
You don't have time.
Yeah.
You don't have time
to catch up
because everyone's at the same caliber at that point.
And not only that, and the way I describe it is, they give you so much information. They give you 25 hours worth of information in a 24-hour day. Now do the math there. That's telling you you don't have enough time.
One more.
Carry the one. Carry the one.
It's
the 2. Carry the 2.
Minus.
Right. But you don't have enough time to learn it all. So it's kind of a brilliant concept, and you don't even know it's happening to you.
They're conditioning
but they're conditioning you to be able to handle a bunch of information at one time.
Right.
And then decipher, okay, this is important, this is not important, that's important.
Yeah.
It's multitasking, basically.
Sure.
And you realize, okay, I'm not going to read the whole chapter because there's not enough time in the day. But you start to train yourself. Okay, what's most important here? You learn concepts.
You're triaging.
What's important. So when you get into like on on a real thing, like, okay, in residency is the most stressful thing you go through. Like in private practice is easy compared to residency.
Because you own your schedule in private practice. In
right.
residency.
And you can pick and choose what you want to do in private practice for the most part.
I've seen those videos where they've got those residents, and there's the main doctor or surgeon, and he's just asking these questions to them. You know, what do we know about this? Or tell me everything you know about this. And those people look like day one privates, you know, in the military. Like they had already graduated from medical school.
They're already docs.
They're already doctors. They're going through the residency, and they
And then you got some of those. They're called attending physicians, which is the boss. The attending physician, depending on how they are, just like in the military, they will grill you. If you don't know the answer, they will rip you up, down, all around, and make you feel small.
So I mean, I know it's a TV show, but Scrubs, that relationship that head doc has, where he's just devastating people.
You have those guys. Now you have other ones that are also like your best friend.
Sure.
But I mean, you have those that just rip you if you do not have an answer, or you didn't. Hey, you mean to tell me? Because when you go on rounds. Like, let's say you go on rounds with the whole group at like 7 a.m. Well, you've already every one of the younger docs, like the interns, the residents, we've already seen all those patients. So we may get up at 4 a.m., for example, and round on all the patients. You might have 20 patients to see, and then you have to be able to present all these patients.
Oh, okay.
And of course, it's like anything else. When you go around, the attending always asks you the one question that you didn't know the answer to. You know, you're prepared for all the real important questions. They'll
Probably
throw
by
some
design.
obscure yeah, absolutely, it's by design. And
you can't say, I heard your question, but what I think you meant to ask me was.
No way.
I think at this point in the 21st century, we're dealing with definitiveness. You know, it's not like, I'll tell you a story. When I was in Afghanistan, I walked in after a buddy got blown up. They had a surgical team there. And I mean, I walked in and they were mopping up the blood. They removed both his legs from all the way up to the top. He was just a half of a soldier at that point. I could not imagine literally operating in that environment, because that was not a hospital. You literally opened a wooden door.
Yeah,
there's plastic everywhere, and these doctors, they just look like beaten, distraught. Not because the surgery was difficult, maybe because of who they were working on. I imagine that stress gets to people after a while.
You know what? Maybe this is I'll say this. I've always had kind of this, I guess, gift, if you will. I don't get too emotional about that stuff. I don't know if that's a flaw in my character, or if that's, you know what I mean? My point is that I never felt that like if.
So you looked at it like a play, like this is a game. Like, hey, I'm
disassociated
from it. I know what I got to do. Emotion's not going to be helpful.
You have to keep it that way. You have to keep it like, well, it's just like you guys on the battlefield. You can't be thinking about. You have a job to do.
Your world has to be very, very small. That's what
we
call it. We focus on the here and now, and what we call as a 25-meter target. I'm worried about killing you, then you, and then I'll worry about the guys further out.
And protecting your buddies.
Yep, my world is very small.
Right.
Let me ask you. Yeah. Dr. Death. You ever heard of that?
Yeah.
Tennessee residency.
You talking about the wrestler that went in a 3-point stance against Hacksaw Jim Duggan at Barton Coliseum in Little Rock, Arkansas?
Clint, the great detractor. Everyone give it up.
Very well.
Yeah. No, you mean the guy in Dallas?
Yeah.
Yeah, the spine surgeon.
How did that happen? How did that happen?
There's a documentary on that.
And there's podcasts. I thought.
I've listened and watched them all. How did that happen with all the checks and balances?
You know what? It's a stain on our community, if you will.
Sure.
Because you ask yourself, and again, I don't know the story specifically. I know people are really deeply involved in that. Meaning they turned them in. Okay.
Yeah.
But they how did that I mean, from my understanding, he got past, like, I started almost in medical school. I mean, it's like every step of the way people were just like passing this guy. You always hear that, and it's always like that. It's always the one that gets the notoriety is the one that something bad happens to. But you wonder, is it happening elsewhere? I don't know. I mean,
yeah,
I don't know. Ross likes bringing that up in the first serial killerology, where he talks about how many undocumented serial killers that are active right now.
That are actually out there.
Yeah, no, it's awesome.
I mean, how many?
Super excited to hear that.
I don't want to digress because we're going to get to that.
Yeah, we'll get to that later. What I think happened in Tennessee was when he was doing his residency. I think he was in good with his. You said the leading,
maybe the attending.
Yeah, the attending position.
Mm-hmm.
And as the time went on, and they were kind of checking back with him, like, hey, is this guy legitimate? He kind of looked at his records, maybe didn't keep great records and didn't have a great memory. He said, yeah, he was fine. And that kind of perpetuated it.
And I want to tell your listeners that is so rare that happens. I mean,
for sure.
we just, I mean, our community has so many checks and balances.
Sure.
That's just,
it's an anomaly.
But it's like any other profession. There's going to be one or two haywire things that happen, and then it gives us all a bad name.
I'm with you on that. I don't think it gives you all a bad name. I think that people generally have a good trust in the attending physicians. Not so much the billing part. I don't understand why I can't ask you how much it's going to take for you to fix my wrist.
I agree with you.
Yeah.
I mean, I can tell you if you want to go down that route, we can talk health insuranceology.
That's a whole nother,
yeah.
That's on the hateology podcast.
Yeah.
Quick question for you, real quick.
Ahead.
What's your favorite part? Like, as I've gotten to know orthopedic surgeons, they're generally capable of working on the whole body, but there's an affinity, affection for, or a deep understanding of a particular motor system or a particular region of the body. Yeah. What's yours?
When I came out of residency and fellowship, I always thought the knee was my thing.
Yeah.
But I've actually kind of moved over where what I enjoy the most is actually shoulder.
Yeah.
Shoulder's probably my favorite.
That's a pretty complicated joint.
Well, and that's why, because if you're in DFW, you can walk down the street and almost trip over an orthopedic surgeon where there's so many of us. But because it's a big city, there's
a lot of injuries too. Yeah.
But we all have subspecialties within our specialty.
Sure.
And I tend to think that I do a pretty decent job with shoulders, relatively speaking. And knees. I do shoulders and knees, but if somebody were to ask me if you could only do one body part,
I'll give you credit for that one.
And I love those.
Yeah, I do.
But we don't get. There's not many of those that happen. It's relatively rare.
He told me I was going to be stronger afterwards, so I tried to get him to do the other one.
Yeah,
I was
like Tommy John surgery.
Let's just knock out the other one while we're here.
Yeah.
He's like,
there you go.
It's against the hypocritical oath.
Yeah, that's it. That's what they call it, the hypocritical oath, right?
Hippocratic or hypocritical?
Nah, it's hypocritical if you're that guy from Tennessee.
Hippocrates?
Yeah. Do no harm.
That's right.
Hey, appreciate y'all listening today.
We'll do more SurgeryOlogies with Tim.
We're gonna have to because I didn't even feel like we even grazed the surface.
Yeah.
So, you go deep in surgery.
Yeah, we go deep.
We get under the skin in surgery.
That's to leave you with this. That's the comment. No, it's don't let the skin stand between you and the diagnosis.
Oh wow.
That could almost be a serial killer.
Yeah, we can end on that note.
Oh.
Hey guys, thanks for listening. Catch us up. We've got a few of these we've kind of put on the shelf where we're going to be releasing a lot here coming up soon. So stay with us. Stay patient. We're also building out our podcast studio.
The network.
And we have the whole network. We're going to have a whole bunch of podcasts. We got our cameras in today or a couple days ago. It's been fun fidgeting with them. As always, our Venmo and Cash Apps are in the bio. Please give what you can. We don't want your mortgage payment. Contribute, yeah. Appreciate y'all listening.
If you see Lil Sweet walking around your neighborhood, tell him that he's got the wrong address and just send him anywhere you want.
There you go.
Send him somewhere else.
We'll see y'all next time.
Goodbye.